I'm Sara Gagliano, and I am the breast cancer rehab specialist at Spooner Scottsdale. And I am so lucky to be joined with one of my favorite patients, Kim. How did you get to physical therapy to see me in the first place?
Well, I was originally introduced to a woman through a friend who had gone through her breast cancer journey last year. And she was introduced to me as the ultimate researcher and left no stone unturned. She went to a number of doctors and interviewed them, oncologists, breast cancer surgeons, radiologists, and she shared with me all that information. The last thing she said to me was that I must not forget to have physical therapy, and I must have therapy with Sara Gagliano at Spooner Scottsdale. The interesting thing is none of my surgeons or doctors ever mentioned physical therapy, and I feel that that's been one of the most important parts of my rehabilitation.
I know that you weren't directly sent to PT from your doctor. Did you have to get a referral from your doctor? What doctor did you get a referral from if you needed it?
Actually, I didn't get a referral from any of my doctors. I called directly.
Awesome. It's good to know that you were able to do that and didn't have any problems, because I think people sometimes don't realize that you don't need a direct referral from your doctor. You can go straight to PT. Okay, so I know you kind of already said that you felt PT was really important to you, but was there anything specific that you felt that was really like the most important part of PT, or what helped you the most?
I think the knowledge that was imparted was the most important part of my therapy. Sara has worked with lots of patients with all different types of breast cancers, all different types of therapies. She knows all the doctors, and she was able to give me knowledge and information that I didn't get from any of the surgeons, the oncologist, or the radiologist. She was actually able to coach me along the way when I was feeling that I was at a dead end. Recently, I've been suffering some very significant side effects from a drug that I have to take post-surgery. My primary doctor sloughed it off, saying that it wasn't the drug that was causing my significant issues. I was not getting a response from my nurse navigator at my oncologist that was satisfactory. And Sara, knowing everybody in the area, suggested that I contact the nurse navigator at my breast cancer surgeon's office because she had worked with an oncologist in the past. I went to that person, and that was the key that needed to get inserted into the hole to open up the success.
Since I know, Kim, that you have done a lot of research and you've learned a lot of things along your journey, is there any piece of advice you would give to someone else who is also maybe going through the breast cancer diagnosis and treatment pathway?
I think it's important to be your own advocate. Do your own research, network, know everything you can about your breast cancer journey so that you can make informed decisions.